Take off your shoes right now, not after this video, now. Slip them off and set them on the floor beside you because what I am about to show you is something your body may have been trying to communicate to you for months, possibly years, through the one part of your anatomy you look at least and understand the least, your feet. Most people believe that diabetes is caught through a blood test. You feel unwell, you go to your physician, blood is drawn, results come back, and that is the moment of discovery. I understand why people hold that belief. For decades, that is exactly how the conversation has been framed in clinical medicine. But here is what that framing leaves out. By the time a fasting glucose number crosses the diagnostic threshold for type 2 diabetes on a lab report, the biological damage has typically been accumulating for 15 to 20 years. The nerves have been under sustained chemical attack. The small blood vessels have been progressively narrowing. The tissues at the furthest point from the heart, the tissues in your feet, have been receiving compromised circulation, compromised oxygen delivery, compromised repair capacity for a very long time. The diagnosis is not the beginning of the disease. It is the point at which the disease can no longer be hidden by the body's compensatory mechanisms. And long before that point, your body was speaking, quietly, specifically, in a language written on the skin and nerves and circulation of your feet. My name is Dr. Kenji Sato. I am a preventive medicine physician and longevity researcher, and the 9 signs I am going to show you today represent the clinical pattern I have observed in patients who were told their blood sugar was fine right up until it was not. Signs that were present, visible, and interpretable long before any lab value crossed a diagnostic line. Understanding these signs does not replace a blood test. A fasting glucose test costs approximately $12 at any certified laboratory and is covered by Medicare for most people over 65. If anything you see or feel in the next several minutes matches what I describe, schedule that test this week. Not this month, this week. But first, know what to look for. Before I go further, one clinical note. If you are currently experiencing sudden loss of sensation in a foot or leg, an open wound on your foot that has been present for more than a week without improvement, sudden severe swelling in one leg that is significantly larger than the other, or any skin change that is rapidly darkening or developing an unusual odor, stop this video and seek same-day medical evaluation. These are signs that require immediate clinical attention. No information in this video applies to those situations. If what you have is gradual, slow, a pattern you have been noticing for weeks or months, and explaining away as aging or overuse or winter dryness, stay with me, because what I am about to describe is almost certainly happening in your feet right now. The first sign is the one almost every patient has already experienced, and almost every patient has already explained away. Tingling, numbness, the sensation your patients describe as, "My foot fell asleep, except it happened while I was sitting normally in a chair." Here is the mechanism. Your nerves are insulated by a protective sheath called myelin. Myelin allows the electrical signal from your brain to travel cleanly and quickly to the tissue it is trying to reach, the way a rubber coating allows electrical current to flow through a wire without leaking into everything around it. When blood sugar is chronically elevated, glucose molecules chemically bond proteins that make up that myelin sheath in a process called glycation. The sheath degrades, the insulation thins, the signal becomes inconsistent. That inconsistency is what you feel as tingling, as pins and needles, as an intermittent numbness that seems to have no positional explanation. This is called peripheral neuropathy. The American Diabetes Association estimates that it affects nearly 50% of people with type 2 diabetes, and it almost always begins in the feet, because the nerves serving the feet are the longest peripheral nerves in the body. Length makes them more vulnerable to the cumulative damage of glycation because there is more surface area to be affected, and the signal has further to travel through compromised insulation. The critical clinical distinction is this. Occasional numbness from sustained pressure on a nerve is normal. Recurring numbness that happens without a positional explanation that wakes you from sleep, that is present when you have been sitting normally, is not normal. It is a signal. A 20 to 30-minute walk each day is the most effective single habit for preserving blood flow to peripheral nerve tissue. Not a run, a walk. Movement drives circulation into the small vessels that feed the nerve sheath, and reducing added sugar in your daily diet begins reducing the glycation load on those nerve structures. Not next week, beginning at your next meal. The second sign is the one my patients describe as the most distressing because it does not come during the day when there are distractions and movement and other sensory input competing for attention. It comes at night, in the dark, when you are lying still and there is nothing between you and the sensation. A burning in the soles of the feet. Here is what is actually happening. Nerve damage from chronic elevated blood sugar does not always produce silence. In some patients, the damaged nerves become hyperactive. They send signals to the brain in the absence of any genuine stimulus. The brain receives a heat message, a burning message, a pain message, and there is nothing physically hot touching your foot, nothing generating that signal from outside. The signal is being generated internally by nerve tissue that has been chemically damaged to the point where it no longer fires accurately. Research published in Diabetes Care found that burning foot pain is one of the earliest reported symptoms in patients who are later formally diagnosed with type 2 diabetes, frequently presenting 1 to 3 years before diagnosis is made. 3 years of a symptom that most people attribute to being on their feet all day, to the summer heat, to shoes that do not fit quite right. 8 glasses of water daily supports the kidneys in clearing excess glucose from the bloodstream, which reduces the sustained chemical exposure the nerve tissue is experiencing. And increasing dietary fiber at every meal through vegetables, legumes, and whole grains where appropriate slows the rate at which glucose enters the bloodstream after eating. Slower glucose absorption means lower glucose peaks. Lower peaks mean less glycation accumulation on the nerve tissue that is generating that burning signal. The third sign is where the conversation shifts from uncomfortable to genuinely dangerous. A small wound on the foot that is not healing. You had a blister from a shoe 3 weeks ago, a small cut, a spot where the skin broke during a walk, and it is still there, still open. Not infected, not dramatically worsening, just not closing. Here is the biological reason. Wound healing requires blood supply. Specifically, it requires the microvasculature, the smallest blood vessels in the tissue, to deliver oxygen, white blood cells, and the proteins that rebuild damaged tissue to the site of injury. When blood glucose is chronically elevated, these small vessels undergo the same glycation process that damages nerve tissue. They stiffen, they narrow. Their walls become less permeable to the cells and compounds that need to cross from the bloodstream into the tissue. The wound healing machinery exists in your blood, but the delivery route has been compromised. The oxygen and the white blood cells and the repair proteins cannot reach the wound efficiently enough to close it before bacterial colonization begins. The Centers for Disease Control reports that diabetic foot ulcers are the leading cause of non-traumatic lower limb amputation in the United States. More than 100,000 amputations per year. Almost every one of them was preceded by a small wound that was not healing, that was present for weeks before it was evaluated clinically. Tonight, after your shower or bath, sit down with good light and examine both feet. Look at every toe. Look between every toe. Look at both heels. If you find any break in the skin that has been present for more than 48 hours without clear improvement, clean it with mild soap, apply an antiseptic, cover it, and if it is not meaningfully improved in 48 more hours, contact your physician. Not at your next scheduled appointment, within 48 hours. I want to tell you about a patient I will call George, 67 years old, retired, active, no diabetes diagnosis, came in for a routine examination. Before any blood was drawn, I asked him about his feet. He told me his feet had been a little numb for a while. He thought it was age. He mentioned that his heels had been cracking badly this past year, and lotion was not helping the way it used to. He mentioned that his feet felt cold at night, even under blankets. He had 4 of the 9 signs I am describing today. His fasting blood glucose came back at 214. He had been diabetic for more than 2 years without knowing it. Every sign had been present. None of them had been connected to blood sugar because nobody had shown him the connection. The 4th sign is visible. It has likely been there for months, and it is almost always explained as sun damage, or just the way my skin is, or something that runs in the family. Discoloration around the ankles, a darkening of the skin, sometimes a deep red tone. In some patients, a bluish tint. Here's the mechanism. The skin of the lower legs and feet is served by the smallest and most distal blood vessels in the circulatory system. When those vessels are damaged by chronic glycation, oxygenated blood arrives inconsistently and in insufficient volume. The skin receiving inadequate oxygen undergoes visible changes. The color shifts. The tissue becomes thinner and more fragile in those areas, because skin that is not receiving adequate nutritional supply cannot maintain its structural integrity. A study published in the Journal of the American Academy of Dermatology found that these skin color changes are detectable on average 18 months before a formal diabetes diagnosis. 18 months of visible signal that almost no one is taught to interpret. 5 minutes of ankle circles, toe raises, and calf stretches each morning generates enough muscle pump activity to meaningfully improve circulation into the lower legs and feet. Even in people with significantly compromised circulation, this small amount of movement produces a measurable difference in blood delivery to the tissue that is showing these color changes. The 5th sign is the one almost every patient dismisses as seasonal dryness. Cracked heels that do not respond to moisturizer. Dryness so persistent that no amount of topical treatment produces lasting improvement. The mechanism is not what most people assume. The moisture balance of the skin is regulated in part by the autonomic nervous system. Specifically, the autonomic nerves control the sweat glands that maintain the skin's natural hydration from within. When these nerves are damaged by chronic elevated blood sugar, the sweat glands in the feet receive incorrect or insufficient signals. They stop producing the moisture the skin depends on for structural integrity. The skin dries from the inside out, and no topical application addresses the internal nerve dysfunction driving it. The cracks that form are not a cosmetic problem. They are open entry points for bacterial and fungal infection in tissue that already has compromised circulation and compromised immune response capacity. A crack in the heel of a person with significant blood sugar dysregulation is a clinical concern, not a seasonal inconvenience. The American Podiatric Medical Association identifies chronic treatment-resistant heel cracking as a significant indicator of autonomic neuropathy in older adults, a condition that reflects not surface dryness, but nervous system dysfunction. Apply a quality moisturizer or pure coconut oil to the soles and heels every night before bed, never between the toes, where trapped moisture creates conditions for fungal growth, and address hydration internally. 8 glasses of water daily supports not just kidney function and glucose clearance, but the systemic hydration that the skin depends on for baseline integrity. The 6th sign connects your feet to an organ most people would never think to associate with the sensation of tight socks at the end of the day. Persistent swelling in the feet and ankles, sock marks that remain visible long after the socks are removed, swelling that is present in the morning before you have been on your feet at all. Here's the connection. The kidneys regulate fluid balance in the body. They filter blood continuously, removing excess fluid and excreting it as urine, maintaining the fluid equilibrium that keeps tissue appropriately hydrated without excessive accumulation. When blood glucose is chronically elevated, the small vessels serving the kidneys undergo the same glycation damage occurring in the retinal vessels and the peripheral nerve microvasculature. Kidney filtration of efficiency declines, fluid accumulates. Gravity concentrates that fluid in the lowest part of the body. The swelling you see in your feet and ankles is in part your kidneys sending a message about the filtration efficiency they have lost. The National Kidney Foundation estimates that diabetic kidney disease affects approximately 1 in 3 adults with diabetes, and lower extremity edema is frequently the first visible manifestation of the kidney stress that precedes a formal chronic kidney disease diagnosis. When resting, elevate your feet above the level of your heart. Even a few inches on a pillow redirects accumulated fluid back toward the central circulation. Reduce sodium intake because sodium drives fluid retention that compounds the edema produced by compromised kidney filtration. And if the swelling is new, is worsening, or is present asymmetrically in one leg significantly more than the other, bring it to your physician's attention before your next scheduled appointment. The 7th sign is the one most commonly misdiagnosed and most commonly self-medicated for years before its true origin is understood. Foot pain that has been attributed to arthritis, to an old injury, to overuse, to plantar fasciitis, and that has not responded to months of ibuprofen or physical therapy or supportive footwear. Here is the mechanism. Nerve damage from chronic elevated blood sugar does not always manifest as numbness or tingling. In a significant proportion of patients, the damaged nerves become erratic and hyperactive. They fire intense, unpredictable signals that the brain interprets as stabbing pain, electric shock, a burning needle through the foot. This happens most intensely at night, when the other sensory signals that partially mask it during the day are absent. The pain is completely real. The nerve signals producing it are completely real, but the source is not a structural injury that ibuprofen can reduce or that physical therapy can rehabilitate. The source is chemical damage to the nerve itself. Masking the signal does not address the damage, and masking the signal means ignoring the message the nervous system is trying to deliver. A landmark study in the New England Journal of Medicine found that painful diabetic neuropathy affects approximately 25% of people with diabetes and is consistently mistaken for arthritis, tendinitis, or age-related joint deterioration in primary care settings. 5 minutes of gentle foot and ankle mobilization before getting out of bed each morning brings circulation into the peripheral tissues before weight-bearing begins. Flex the feet, circle the ankles, pull the toes back gently. This is not treatment for the nerve damage. It is maintenance of the blood supply that the nerve tissue depends on for any remaining recovery capacity. The 8th sign is the one that tells me when I see it that the vascular damage is no longer early. Feet that are cold persistently, regardless of the ambient temperature, cold in summer, cold under heavy blankets, cold when the rest of the body is warm. Here is what is happening. The blood vessels serving the feet and lower legs have narrowed and stiffened to a degree that warm blood is no longer reaching the peripheral tissue in sufficient volume to maintain normal tissue temperature. The circulation is present, but it is insufficient. The extremity runs cold not because the body is failing to generate heat, but because the delivery route for that heat has been progressively compromised by years of vascular glycation damage. The American Heart Association identifies peripheral artery disease as affecting more than 8 million Americans with diabetes as the single largest modifiable risk factor. Cold feet that persist independent of environmental temperature are one of its earliest and most consistent presenting symptoms. A 30-minute brisk walk every day is the most effective non-pharmacological intervention for peripheral circulation. Not a stroll, a purposeful walk with arm movement generating enough cardiovascular demand to drive meaningful blood flow into the peripheral vessels. If 30 minutes is not currently accessible, begin with 10. The direction matters more than the distance. Start today. The ninth sign is the quietest. It is the one almost nobody notices because it requires looking at something that most people look past every day without registering what they are seeing. Hair loss on the lower legs and the tops of the feet. Look at your lower legs right now. Look at the tops of your feet. If there is significantly less hair there than on your upper legs, if the hair is thinning or absent in a way that has developed gradually over recent years, this is not simply a cosmetic consequence of aging. Hair follicles require a consistent blood supply to function. Oxygen, nutrients, the continuous delivery that a healthy microvasculature provides. When the small vessels serving the lower legs and feet are damaged by chronic blood sugar elevation, the follicles begin receiving insufficient supply. Gradually, they stop producing hair. The absence of hair growth is a visible surface marker of vascular compromise that has been progressing beneath the surface for years. Research published in Diabetes, Obesity, and Metabolism found that hair loss on the lower extremities correlates significantly with peripheral vascular disease in patients with diabetes. It is a sign that trained clinicians specifically examine for during foot assessments. It is a sign that patients almost never bring up because they have never been told it means anything. Look at your lower legs right now. If the hair is significantly absent or thinning compared to the rest of your leg, schedule a fasting blood glucose test this week. $12, covered by Medicare for most adults over 65. $12 and one appointment can tell you whether what you are seeing on your legs is cosmetic or clinical. Here is where to begin tonight. Take 30 seconds before you go to sleep. Sit in good light. Look at both feet. Look between every toe. Look at the heels. Feel for numbness or temperature difference between the feet. Look at the lower legs. If you found anything on this list, if one sign matched something you have been explaining away, call your physician tomorrow, not next week, tomorrow. Schedule the blood glucose test this week. The biology behind every sign I described today is real. The damage is progressive, but progressive damage has a characteristic that irreversible damage does not. It can be interrupted, not in every case, not at every stage, but the earlier the metabolic environment changes, the more of the damage remains in the range where intervention produces meaningful recovery rather than simply slower decline. Your feet have been speaking in tingling and burning and cold and cracks and swelling and hair that gradually stopped growing, in the language of a body under sustained chemical stress that has been building for years. Now you know how to read that language. I am Dr. Kenji Sato. If this gave you a clinical understanding that your regular appointments have not provided, share this with someone whose feet have been telling them something they have not yet known how to hear. I will see you in the next one.